see. Start from there. We should start from there. KSL, where are you? KSL and everyone. Let's continue from where we stopped. Okay, you're welcome. 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 You are welcome. Thank you for joining in. You're welcome. You're welcome. Who is here? Who is first to join in? Who is first to join in? You are welcome. Welcome. Where are you joining in from? Thank you for joining in. You're welcome. Where are you joining from? Who is here? Shall we continue from where we stopped? Something new. Okay, Ajayi Ido. You're welcome. Thanks for joining in. Yes to what? Good afternoon. Thank you, Ajayi Ido. Please, where are you joining in from? Where are you located? What time in your location? Are you in Nigeria? Thanks for joining in. Let's continue our health talk. Apologies for the break for those who were with us previously. Okay, Ekiti State. Wow. Ekiti State in Nigeria. So how are we? Are you subscribed? Are we connected, or did you just see this notification on your YouTube? YouTube, Ajaido, are you subscribed to my channel, or you just got a notification on YouTube for this live? Are you subscribed to the channel, or okay, you are subscribed to the channel? Okay, thank you for being a member of the community. Thank you for joining this live. I believe my audio is very clear now, right? So how are you doing, Ajayi Ido, Ajayi, and do you have any health related question? I'm here to respond to your question or questions. Earlier, we were talking about people were sharing their experiences. You, as an individual, understand what your doctor would want you to know and do. Okay, and I emphasize the fact that it's not just about knowing, there is the place of doing, and that's where you get to see the results. Okay, so when your doctor says you need to exercise and you know it, it's not just about the information, you need to get to doing it. And it's in the doing that you get the rewards. For example, if you are trying to monitor or manage your weight, trying to do weight reduction, then you need to understand the role of exercise and diet in the management of your weight. Okay, so exercising will help you to burn calories. You will definitely uh, get your joints working actively. So the risk of having arthritis, joint pains from being overweight or obese will be reduced significantly because you are controlling your weight. And then when it comes to diet, control on the calories, control on the type of foods, limiting as much as possible carbohydrates or starchy meals, and of course, low fat, healthy fat preferable, and then the need to eat vegetables and fruits. So when you do this, when you do these things, you definitely will get results, and those results are usually amazing. It's usually encouraging when you know what to do and then you decide or agree with your doctor to do it. The results are amazing, and you get to know, you feel it. Your doctor also is happy. All right. So someone was actually sharing with us earlier that when he or she takes a lot of water, it helps to not just hydrate, of course, your cells, but it helps your joints. That's a way of improving blood supply to your joints, blood flow, and then there is reduction in the friction that you may be experiencing in your joints. So that's one thing that you get to enjoy, and then you will be less constipated when you take a lot of water. Water is very important. 70% of the human body consists of water. So that's critical. It's very important. Hydration is very important. So it reduces your risk of being constipated, and then it really helps your digestion, so you do not have tummy problems. If you have any question you would like me to respond to, then you can drop in the chat box. Welcome everyone. Let's know where you are joining us from, and then what time it is in your location. Remember to double tap on your screen to like this session. All right, so we will continue from where we stopped. Um, KCL was sharing his experience of having an hair discharge, and I was asking that if this had happened, if he had a similar experience while he was growing up as a child, and there's a possibility of having a recurrent ear infection if it was not properly treated as a young person. So there are vital organs in our bodies, including the ears, our ears, the ears, the eyes, nose, mouth, uh, teeth. These are sensitive areas of our body that we must definitely uh, give adequate attention. And if you are a parent or as an adult, when you find out there is a child around you that has any complaint, maybe related to the eyes, to the ears, to the mouth, to the nose, these are very sensitive areas, and such should be given immediate attention. Thank you for the like. Ajayi Ido. Okay, say yes. Thank you for the like. Thank you. Thank you for your comments. Say well done, sir. Thank you too. Well done for joining in and for staying tuned. Okay. So talking about the need to pay attention to children, there's a way some medical conditions need to be treated to avoid recurrence or damaging effects um, in the future, in the long term. So for KCL, I was going to ask about a similar history as a child, and then what was done then, and his current practices. Does he use ear swab? Does he, that's not really advisable, especially the fact that a number of people actually put in the probe, the cutting board, into the inner part of their hairs, and this actually does pushing the wax that is supposed to come out. Okay, there is nothing wrong in cleaning the external aspect of your hair, but the more you push in the cutting board, then the more you are likely to have a wax impaction. So that's even something that can cause difficulty in hearing, and some people actually have that as a cause of their difficulty in hearing. So you should note this, and then you should note that you should not introduce any kind of substance except what is recommended by your doctor, maybe an hair drop, into your hair, because um, a number of substances, they are sensitive parts of your hair, the inner hair, and any substance that can damage any of these parts can lead to a long lasting effect. For example, difficulty in hearing. So this needs to be looked at. Okay, and for anyone having recurrent ear discharge, you should see your doctor, because definitely a history needs to be taken, and then there are many causes. It could be a trauma, an injury to the tympanic membrane, the covering in the inner ear. Okay, so if that happens, you need to consult with your doctor so that you can have a proper evaluation. Examination will be done, and definitely that would help to pin on the diagnosis, pin down on the diagnosis. Then it's important to note that different investigations can be done to confirm, if for a discharge from the hair, for example, to confirm the type of organism. If it's infective, definitely will require antibiotics, and it's sometimes not just empirical treatment. It may require confirming the type of organism causing the infection in the hair, and then other methods of management and support will be given to the individual. Thank you, Ajayi, Idowu Ajayi, saying well done, sir. Thank you so much. Thank you. Rajesh Spicy. Hello, sir. How are you? Thank you, Rajesh, for asking. I'm doing well. Hmm. Okay, Rajesh, you have observed the the um, the growth, yes, as your video are reaching worldwide, reached 1,800 subscribers. Now, I think it's yes about 1,800 more. Yeah, as I'm one of the subscribers joined at the starting of your YouTube channel. Okay, Rajesh, thank you for being a great foundational member of this community. We have many people who are actually members of this great community, and I appreciate every one of you for all your support, for all you do, for your comments, for watching the videos, for the feedbacks, very great feedbacks. And then this encourages me, having done 3 years, I'm doing more on YouTube, uploading videos. It's getting more interesting. I'm hoping to have more time, all right, as I move on the ladder in the profession. Clinical work, it could be really demanding. So that was what happened the other time. We were on the live. It was really getting interesting. KCL was there. Um, some other people now were there. It was getting interesting. Yes, Penina Life. I'm trying to remember now. So many other people were part of the live session. It was really getting interesting. All right, so we continuing from there. I just talked about why it is important for KCL to seek. Yes, Penina the Grace. Just on time. Okay, you're right with us. Thank you. Penina the Grace. Yes. Very, very interesting. Okay, good to have you here once again. The apologies the other time we couldn't continue the conversation, but clinic work. I'm sure you know. Yes, you mentioned it that I was at consultation the other time. Yes, I was consulting, and I needed to mute, and then I'm sure people were really engaging. They were commenting. I mean, communicating in the chat, and I was finding it interesting. Casey was describing the symptom he was having. He was also talking about how he gets to drink gallons of water. Now, are you there? Do you know how many? Louisa, I'm sorry. Louisa, I know you're here. I'm going to give you a special welcome. Special welcome to our Louisa. Welcome, madam. Everyone, please welcome Louisa. Yeah, yeah, yeah. Louisa, oh, yes, yeah. Good afternoon, sir. Thank you, Louisa. It's been a while you caught up with my life. Yeah, it's been a while. Yes, really, I think the past week I didn't really come up live. Maybe this week now I decided to do more. I know people are really missing me. So I hope to catch up, and I mean we're able to, so that we can do more together. And then looking at the timing, sometimes I go very early hours or late in the night because I'm considering most of the subscribers and audience in the United States, where I have more subscribers, or most of the subscribers, than Nigeria, Kenya, UK, Canada, Uganda, and all that. So I am not neglecting Nigeria. Now, Nigeria is second on the list now of number of subscribers. So thank you, Louisa, for joining in this time. I'm looking forward to having you more. Where is MK? Where is Chichi, Chinye? Where is Sandy? Where is KCL? Where is Famous? Where are they? Where are the twins? My favorite twins. Where are they now? So Penina, yes, what happened was consultation. Yes, you're right. Louisa, I've responded to your greeting now. Yes. Penina laughing. Louisa, yes. Hope inspires. You are here. Good to have you here again. You know, the last time we were together, I think you came in briefly and left. I tried to call your attention again. So good to have you here again. Um, Penina says, welcome, sis. Hope inspires says, Louisa, or my fellow dog hater. Oh, Louisa is, oh, my fellow dog hater. Louisa ate 8 dogs. Wow. Louisa